Okay, welcome back all to the sixth annual Functional Medicine Symposium for 2023. Very special guest today, Dr. Paul Marik. Many of you will know him from his reputation and also through the FLCCC. Today, his topic will be photobiomodulation. There'll be a PowerPoint slide presentation and then some Q&A afterwards. So I'm going to turn the program over to Paul, and he can talk more about his bio and then get on with the slide show.
Well, thank you, JP, for inviting me. It's a pleasure and an honor. So while I share my screen, I'll just briefly introduce myself because I think people want to hear more what I have to say than about me. So basically, I'm a critical care physician. I was tenured professor of medicine. I did train in South Africa. And then due to all of the nonsense associated with COVID, basically I had to resign my position. So I don't practice patient care anymore, but I am involved in the FLCCC, which I founded with a bunch of colleagues, Dr. Corey, Veron, Iglesias, Maduri, in March of 2020. Which started us on this really interesting journey. So this is a journey really into discovering the truth and figuring out that a lot of what we told in mainstream medicine is basically not based on science, not based on the truth, and we've been profoundly misled. So what I'm going to talk about today is photobiomodulation, which it's only through, my work looking at how to help the vaccine injured that I came across this fascinating topic. And so it really has enormous implications. So what I would suggest, if folks are interested in what we do, they can go to flccc.net. We have a whole bunch of protocols for both COVID as well as, other health-related issues. Most recently, the management of type 2 diabetes, intermittent fasting, and currently I am working on a protocol for the off-label use of drugs for the management of cancer. So with that, I'm going to get started. I'm going to be talking about sunlight, photobiomodulation, and sauna. Importantly, I don't have any conflicts of interest. So, this is important. Neither myself nor FLCC are selling any product or any entity. We have no commercial investments or connections. We just here to provide information and to empower both patients, the public in general, and healthcare providers. So it is a somewhat complicated topic, but as you'll see, it's very much interrelated. So we're going to be talking about near-infrared radiation, but you will see how this links to sunshine, melatonin, blue light, mitochondria, ultraviolet light, and saturated fats and vegetable oils. So all of these things are kind of connected. So this is us humans. We've evolved, as you can see, over millions of years. That's me on the left. That's JP on the right. I'm still somewhat of an Australopithecus from Africa. Anyway, the bottom line is that Paleolithic, Neolithic man has really evolved over 2.5 million years to maybe 10,000 years ago. And so that's embedded in our genes. And this is how we evolved. Our present lifestyle is really since the 1940s, so maybe 80 years. And obviously, genetically, our genes haven't evolved as rapidly. So, we have the genetic makeup of a Paleolithic man, which is really important in terms of much of what we're going to talk about today. So if you actually look at Paleolithic, the Neolithic man, He ate a predominantly carnivorous diet, high in saturated fats. And as we'll see, saturated fats are actually healthy. There's nothing unhealthy about saturated fat. He was exposed to sunlight and fires. So during the day, he walked around in the bush and outside of his cave and was exposed to sun. And you'll see infrared light, which is really important because it switches on mitochondrial melatonin. And at night they had fires, and you'll see fires glow infrared light. During the daytime, they walked around in the pastures and were exposed to blue sky. And that's really important because this switches off the pineal gland and melatonin production. So it's really an important concept of this diurnal variation in melatonin production. And so if you're actually exposed to light at night, bright light or blue light, you switch off melatonin production. And this is actually increases your risk of cancer. There's really good data showing that low levels of melatonin increase your risk of cancer, particularly in nocturnal workers. And in fact, shift work is classified as a type 2 carcinogen. So human evolution really provides the best epidemiological studies on nutrition. So obviously, as I said, we were hunters and gatherers, and that's how we evolved. Our diet was based on hunting and gathering and eating intermittently. We didn't have a supermarket right next door, and therefore we didn't eat processed foods, and we didn't eat all the time. And really, this has had a fundamental impact on human health and well-being. And as I said, you know, this modern diet is a diet really in the last 50 years, and we haven't evolved genetically to deal with this, this terrible diet that we have. So this is Paleolithic, Neolithic man. You can see in his cave cooking and being exposed to fires, which is important. So we need to speak about the solar spectrum. And so this is really critical to what we're going to talk about. So this is the solar spectrum. So at the one end, we have ultraviolet light. And it's interesting that UVB comes before UVA. And you'll see the importance of the difference between UVA and UVB. UVB actually is shorter wavelength than UVA. And we will talk about this. Then we have the visible spectrum, which goes from purple and blue and green and yellow, orange and to red. At this extreme, about 760 nanometers. And then going further with increasing wavelength, we have infrared A, infrared B, and infrared C. So this is most of near infrared is in this wavelength spectrum. And so this graph is fundamental to understanding really what we're going to be talking about today. So again, this is the solar spectrum, again, going from, you can see 250 nanometers to 1500 nanometers, the infrared. And so the area under the curve represents the quantity of the solar spectrum. So you can see this is visible and this is infrared. So near infrared makes up about 40% of the solar spectrum. And as we'll see, this is very important. UV light is at this end. So what is fascinating is the different wavelengths of solar radiation penetrate different degrees through the skin. So you can see blue, green, red, and near infrared. So with increasing wavelength up to near infrared, there's much greater penetration through the skin. So near infrared, as you can see, penetrates into tissue up to about 23 centimeters or 9 inches. So this goes down through the fat through to myocytes. And as you'll see, the significance of and the importance of near infrared radiation. And as I said, sunlight consists of about 40% of near infrared radiation. And as we'll see, humans now over the last century are now deficient in near-infrared. So this graph actually highlights how the exposure to near-infrared has almost disappeared in a modern man. And you'll see the importance of being near-infrared deficient. So this is the 1800s. People were outdoors. They were exposed to sunlight. In the 1950s, we had incandescent lights, which, as you'll see, do make infrared light. They had windows which allowed penetration of near infrared. Then we started switching to fluorescent lights and windows which actually filtered out near infrared. And now we have LED lights and e-glass windows, which basically, and people don't go outdoors, which resulting in a profound deficiency of near infrared radiation. So we should speak a little bit about modern glass and windows. This is normal clear glass, but most windows these days have what's called an e-coating, which completely filters out near infrared light, which you'll see the importance. But paradoxically, it also allows ultraviolet A to get through. So it blocks infrared, but allows ultraviolet A. And you'll see the health significance of this. So this is trying to show the difference between LED lights and incandescent lights, the old-fashioned filament lights. So you can see this in orange is solar radiation. You can see incandescent lights in blue. So the old filamentous lights actually produce a fair amount of near infrared and far infrared, as well as clearly visible. But you can see with the LED lights that are now, ubiquitous wherever we live, there's absolutely no infrared. So LED lights emit no infrared at all. We then need to talk about free radical generation as a function of wavelength, because this is important when it comes to ultraviolet radiation, and why ultraviolet per se may be carcinogenic. So you can see this is free radical generation with ultraviolet B and ultraviolet A. So you can see paradoxically ultraviolet A, which has a longer wavelength, actually produces more free radicals and is implicated in carcinogenesis. But it just so happens that while ultraviolet light produces reactive oxygen species near infrared, so this is part of the solar radiation, as we'll see, acts on your mitochondria to produce melatonin, which counters these reactive oxygen species. And so this is one of the real importance of solar radiation and infrared, that it causes melatonin production, which counters the reactive oxygen species produced by ultraviolet. And so when you go outside and walk, the timing may be important. You're looking at the near infrared to ultraviolet ratio. So this is about 3:1 at sunrise. It reaches 1:1 at noon and then returns to about 3:1. So actually, if you want to decrease ultraviolet exposure, which is potentially carcinogenic, as we saw, you actually don't want to walk at noon. You want to go for your morning stroll either in the morning or the late afternoon. So UVB rays are the primary cause of sunburn and largely blocked by glass, as I said. But more than 50% of UVA rays, the main cause of aging, penetrate through glass. So glass allows UVA through, it blocks UVB. As you see, UVA actually has a much higher potential for producing radical species and radical damage. So it's paradoxical that glass will allow UVA through. It blocks infrared, which is protective. So basically, if you sit close to a window that blocks UV infrared but allows UVA, actually increases your risk of skin cancer potentially. And so if you look at the risk of melanoma, this is over time. it's actually gone up exceedingly high. And so melanoma is actually a disease mostly in non-sun exposed areas. And we'll see potentially some of the reasons why this happens. But if you look at non-melanoma related skin cancers, which seem to be ultraviolet radiation related, it's actually gone up significantly. And so this may be due to exposure to ultraviolet without exposure to infrared, and then due to, as we'll see, additional carcinogens. And so despite improvements in overall health, supposedly, and decrease in cardiovascular death, the actual risk of Americans getting cancer has significantly increased, both in people in the elderly and in the young. And so the question is, why is this happening? And so one of the theories actually goes back to the 1960s, when dietary fat was considered a villain and was considered the cause of heart disease and strokes. This was largely this false theory, as you'll see, was propagated by Ansel Keys. This was his seminal paper in 1961. He was on the front page of Time magazine and was considered a hero in solving the diet-heart debate or hypothesis. But actually, it's a little bit more sinister, because in the 1960s, Procter & Gamble essentially created or started the American Heart Association. They essentially founded American Heart and strongly promoted the use of vegetable oils, which persists to this day. There's this false narrative about the harms of saturated fat, and the so-called myth that vegetable oils are healthy. And so this is maybe, as you'll see, part of the cause of the increased risk of cancer. So the American Heart Association recommended vegetable oils. So this was a propaganda campaign, marketing campaign initiated in Procter & Gamble to promote the use of vegetable oils. And so as you can see, from the 1960s, there was a dramatic decrease in the saturation of saturated fats, which were presumed to be harmful, which is in fact false, and a rapid increase in the use of unsaturated fats, which were presumed to decrease the risk of coronary disease, which again was false. So again, this is just a study in American Journal of Clinical Nutrition showing the dramatic increase in the use of soybean and soybean oils. And so just to bring it more up to date, you can see the increase in soybean consumption from 2000 to 2021. And you can see again the consumption of edible oils and soybean oils in the United States, a massive amount of vegetable oils. So why is this important? Well, it actually relates to, this was one of the first studies that's not been well publicized. This was a randomized controlled trial. This is one of the VA studies in which they substituted saturated fats, which were assumed to be bad, with vegetable oils, which was so assumed to be good. And what actually happened is the risk of coronary disease was the same or went up. But most importantly, there was a significant and massive increase in the risk of cancers. So polyunsaturated vegetable oils are unstable. They increase oxidative injury. They change the composition of cell membranes and appear to be carcinogenic. And I've just shown you that there's been a massive increase in the consumption of these vegetable oils. So then going back to the sun and the curative power of the sun, because this is really important. So this is known as the open air treatment of influenza. So as you know, there was a massive outbreak of influenza in 1918. And in fact, the most effective treatment for influenza was sunshine. This was published sometime later. Few medicines were used to relieve patients' symptoms and aid their recovery, but these were considered less important than were regular meals, warmth, and plenty of fresh air and sunlight. So you can see remarkably what they did is they took these hospitalized patients from inside the hospital wards and put them outdoors in the sunshine. And so this was a report by the Surgeon General of Massachusetts, Dr. Brooks. At that time, open air treatment adopted the camp reduced the fatality rate from cases from 40% to 13%. Brooks wrote that the efficacy of open air treatment has been absolutely proven, and one only has to try it to discover its value. So it brings us to COVID-19, and in fact, it appears that there's a very strong correlation between latitude and sunlight. It was assumed to be due to vitamin D, but vitamin D may only be part of the story. It may be more related to infrared radiation, as we will see. So there is, as what they saw in this document, a statistically significant correlation between a country's latitude and COVID-19 mortality, which was consistent with research regarding latitude. It was assumed to be due to vitamin D deficiency, but probably infrared radiation was more important. And we can see this in this study showing COVID-19 mortality with latitude, and the higher the latitude, the higher the risk of dying from COVID. But this may again be more related to infrared than ultraviolet B. And so actually, if you look at dementia, it's really interesting. The same applies. So in Italy, in red and orange is a higher mortality of dementia, and green is a lower. So in Italy, the more north you are, the higher the risk of dementia. And in New Zealand, which is the bottom of the earth, the opposite. The more south you are, the less infrared and radiation you get, the higher the risk. So this was assumed to be due to vitamin D, and vitamin D may play a role, but it's probably much more likely to be associated with infrared, which people don't recognize. And so there are some people who are completely sun averse because they think it's going to cause melanoma, which, as I've shown you, is not true. So this was a prospective 20-year study in 29,000 Swedish women who were sun averse. And what they found was that there was an inverse all-cause mortality, so that the all-cause mortality was inversely related to sun exposure. So the less sun you got, the higher your risk of cancer. So this is really important because I think it's highlighting the importance of sunshine, and in particular infrared radiation, on health. So this brings us to photobiomodulation. So what is photobiomodulation? So photobiomodulation, or low-level laser light therapy, is non-invasive light-driven intervention that involves the use of red and near-infrared light to stimulate healing, reduce pain, protect the aging brain, and decrease inflammation in several tissues, including the nervous system. This is a book by Dr. Hamlin, who is one of the leading experts on photobiomodulation. So many people, particularly in the integrative world, think that, if it's alternative medicine, then, there's not a lot of good scientific data to support it. But that is clearly false. So if you actually look at PubMed, which basically cites peer-reviewed journals that are actually acknowledged by the National Library of Medicine, you can see if you put in photobiomodulation or red light, you get back over 60,000 citations. 60,000 citations. So this is, this medical intervention has been highly studied. And so, it's strongly supported in the scientific literature. And obviously, I'm not going to go through all 60,000 citations. I've just listed a few. Photobiomodulation for Alzheimer's disease. Infrared lights improves cognition in patients with dementia. The use of low light therapy on wound healing. And we're going to talk shortly about photobiomodulation in improving the performance of athletes. So what are the biological properties of red light and near infrared? As I said, near infrared penetrates quite deeply, at least 23 centimeters or 9 inches into the tissue. And it has some remarkable biological properties, and this is proven by scientific studies. Most notably, as we'll see, it increases mitochondrial ATP production. It increases mitochondrial melatonin production, which we've mentioned. So in fact, about 95% of melatonin is probably produced in the mitochondria, but is not circulating. The circulating melatonin comes from the pineal gland, and that is produced at night. Increases heat shock protein, activates cell stress response, increases autophagy, increases microvascular blood flow. It has anti-inflammatory properties. It improves sleep. It decreases appetite, improves wound healing, increases human growth factor. And the remarkable thing about near-infrared light is it really has no side effects. It's completely safe. And so these devices have been actually cleared by the FDA. The FDA is not necessarily our friend, but in this instance, it's considered an insignificant risk device. So photobiomodulation is really of proven benefit in a whole host of diseases. As we'll see, it's potently effective in acute inflammatory diseases, including COVID, in chronic inflammatory diseases such as osteoarthritis, improves wound healing, improves tissue repair. As I said, in patients with neurodegenerative diseases, Alzheimer's, Parkinson's, it's been shown to improve cognition. It's been shown to improve cognition in traumatic brain injury. And surprisingly, as you'll see, if it acts on the mitochondria to increase ATP, increase blood flow, it actually improves the performance of athletes. So this can be considered a performance-enhancing intervention. So how does it work on the mitochondria? What actually it's fascinating. There's a compound or part of the electron transport chain known as cytochrome C oxidase. It's in the mitochondrial membrane. It's one of the essential proteins involved in the electron transport chain. It just so happens that the cytochrome oxidase has absorption bands in the 600 to 950 nanometer wavelength, which corresponds to the red and near infrared spectrum. So both red and near infrared actually stimulate mitochondrial function by irradiating and activating cytochrome C oxidase. And about 50% of the absorption of near infrared light in the tissues is actually attributed to cytochrome C oxidase. So this is a very nice drawing from my friend, Dr. Bean. So you can see this is the electron transport chain on the mitochondrion, which is really essential for generation of ATP. Infrared radiation bypasses these transporters. It acts directly on complex 4. It increases cytochrome oxidase, and therefore increasing production of ATP by ATP synthase. We then have to talk about melatonin because, as I said, melatonin is part of this story. And it was not clear to me that melatonin is actually produced during the day by infrared radiation. And this is, the pioneering work of Dr. Reiter, a pioneer in this area. So mitochondria produce melatonin in many cells in quantities which are order of magnitude higher than that produced by the pineal gland. Mitochondrial melatonin is produced in response to near-infrared photons. So it's fascinating that infrared activates cytochrome C, but it actually also increases mitochondrial melatonin production. So sunlight stimulates the antioxidant reservoir of the cell. So this is going back to the protective effects of melatonin, which is probably one of the most potent antioxidants acting directly and indirectly. So while circulating melatonin is the hormone of darkness, subcellular melatonin is the hormone of daylight. So it's fascinating. We produce melatonin via different mechanisms, both through day and night, and they are really essential for human survival. But these assumptions are no longer valid in modern society, where we spend most of our time indoors exposed to visible light and no infrared. And then at night, we actually exposed to light, which switches off melatonin production. So you can see how this evolutionary cycle is disturbed. And so this is a fascinating paper by Dr. Reiter on melatonin and the actions of melatonin in terms of near-infrared radiation. So if anyone's interested, I strongly recommend reading this paper. So this is a fascinating concept that at nighttime, norepinephrine acts on these receptors in the pineal gland, activates the production of melatonin, which then gets into the circulation. During the day, near-infrared acts on the mitochondria. It activates, as we said, cytochrome C oxidase, but it also activates the same enzyme pathway to make melatonin. So melatonin in the mitochondria, melatonin increases pyruvate dehydrogenase to increase mitochondrial uptake of pyruvate, which increases acetyl-CoA. Melatonin switches off the Warburg effect to increase mitochondrial oxidative metabolism. Very important, increases oxidative metabolism. It increases activity of mitochondrial complexes 1 and 3, in addition to infrared, which acts on cytochrome oxidase. It upregulates the expression activity of mitochondrial uncoupling proteins. It transfers functioning active mitochondria from healthy to injured cells through mitochondrial tunneling. It increases mitochondrial fusion, it inhibits fission, it enhances mitophagy. And melatonin inhibits the mitochondrial permeability transition pore to preserve mitochondrial membrane potential. So you can see remarkably the synergistic protective effects of melatonin and near-infrared on mitochondrial function. So as I said, infrared stimulates melatonin. Melatonin protects the mitochondria, and infrared acts to additionally increase oxidative phosphorylation through cytochrome oxidase. And so there are actually melatonin receptors on the mitochondrion, which are really important in enhancing mitochondrial function, uncoupling protein, ADP synthesis. And so again, melatonin has enormous importance in terms of the function of mitochondria, which are the energy producers. They scavenge reactive oxygen and nitrogen species, as I've said. They increase mitogen fusion, mitogen biogenesis. They're involved in mitochondrial transfer, and obviously are potent inhibiting oxidative stress. So melatonin is a truly remarkable compound in terms of both directly and indirectly affecting detoxification of oxygen and nitrogen species. It has numerous physiological properties, as we've seen in terms of mitochondrial function, anti-inflammatory. And so one molecule of melatonin can scavenge up to 10 oxygen or nitrogen species. And unlike most other antioxidants, it has no pro-oxidant activity. So it really is quite unique as an antioxidant. And this may explain its ability to protect cells against cancer. So cells require near-infrared for optimal mitochondrial function. So they need sun. And as I've said, modern man has been basically deprived of near-infrared radiation. So this leads to profound decrease in mitochondrial function, and again may partly explain the increased risk of cancer, together with the increasing intake of vegetable oils. And then remarkably, just to close the circle, methylene blue targets the mitochondria and acts synergistically with infrared to act on mitochondrial function. So we're going to kind of finish off about LED panels, red and near infrared light. So these panels, you can buy them commercially. There many are available. These panels make just a narrow spectrum of red and near infrared. However, there is this product which I prefer. This is known as thermalite. So how thermalite basically replicates sunlight. So this is the spectrum of these bulbs. You can see it has no UV light, so it has none of the potentially harmful UV, but actually has near infrared in a proportion very close to sunlight. So unlike the LED panels, these devices actually closely mimic sunlight. So it's sunlight without UV radiation. So this is sunlight. This is the thermalite, and you can see that the spectrum of radiation is very similar between the two. So just to show a few studies, this is a study looking in the era of COVID-19, that near-infrared light basically decreases inflammation by TOL4 dependent mechanisms, potently anti-inflammatory. You can see decreasing IL-6 and IL-6 in response to LPS. So near-infrared light resulting in a significant decline in NF-kappa B, APP, anti-protein 1 activity as measured by gene assays, and decrease in the production of these pro-inflammatory cytokines. So near-infrared light works through toll receptors to reduce inflammation. So this is a fascinating clinical study, which I'll go through in a little detail because it basically highlights the profound effect that this can have clinically. So this was a randomized double-blind study, the gold standard, and basically they looked at photobiomodulation using near-infrared LED compared to conventional respiratory physiotherapy in patients with COVID-19. So this was a small cohort, only 30 patients, but you'll see despite that, this is a profoundly powerful study divided into two equal groups. The one got the LED, which was treated with near infrared. The other was the control group. You'll see the devices were switched off in the control group so that patients and investigators had no idea which device they were getting. So this was the vest which they put on the patient. Both the patients as well as the investigators were blinded. And as this is near infrared, there was no red light emitted. So it was completely controlled. And so the two groups were somewhat equally matched. It seemed like the LED group actually was a little bit sicker and maybe had a few more comorbidities. However, when you looked at the clinical outcome, the results were truly astonishing in that the improvement in partial oxygen concentration, indices of respiratory function, indices of lymphocyte function, improved lymphocyte function, and there was a significant decrease in hospital length of stay. So using this device just for a few hours, for a few days, had a profound physiological effect on these patients. And I think this demonstrates the potency of this intervention. It's also being used in athletes. As I said, this was a study looking at photobiomodulation in endurance athletes. And basically what they showed, you can see in red, this is photobiomodulation before and after training, significant increase in VO2 max. So this was a triple-blinded placebo-controlled study. The gold standard, there was a significant decline in body fat. This is a study in futsal. Futsal is a five-sided indoor football game. So what they did is they did futsal before the football game, and you can see that it improved the performance of the athletes. Their lactate levels were lower. The creatine kinase levels were lower. The lactate dehydrogenase levels were lower. So in this blinded study, again, showing that in athletes, it significantly improves athletic performance. So obviously, we've spoken about light, the importance of blue light and red light. So basically what you want to do is during the day and in the morning, expose yourself to blue light, which turns on your signaling through your optic nerve, through the chiasm, release of norepinephrine in the pineal gland, release of melatonin during the day. At night, you don't want blue light or bright light, you want red light, which doesn't act on this pathway. So you want be exposed to fires or red light. So you actually switch off this pathway to allow melatonin to be produced by the pineal gland. So in the winter of 2003, you want to walk in the light of the sun in the early morning or mid-afternoon, exposed to infrared light, exposed to blue light. At night, you want to avoid this. We should then finish off talking about the health benefits of sauna. So there are different types of sauna, traditional sauna. There are actually near-infrared saunas, far-infrared saunas, and a near-infrared sauna. So this basically links the near-infrared sauna to infrared lights. You can get the benefit of both heat and near-infrared. So this is the traditional Finnish sauna. This is a near-infrared sauna where you get the benefit of infrared radiation as well as the effects of heat. This is a far-infrared sauna, which has some issues because of electromagnetic radiation. The benefits of sauna as a lifestyle practice are really well illustrated in this very nice review by Dr. Patrick. Has numerous effects in extending health span, decreases risk of cardiovascular disease, decreases risk of heart failure, decreases Alzheimer's, Parkinson's, and reduce risk of depression. Many papers showing this study showing the association between sauna and cardiovascular events and all-cause mortality. Sauna inversely associated with dementia, and surprisingly enough, sauna decreases the risk of major depressive disorders. So with that, I thank you. I've tried to link together this fascinating but complicated topic of infrared, radiation, melatonin, and sauna. So I hope that was somewhat informative. And JP, if you have some questions, we do have some time.
Sure, very good. Excellent presentation, Paul. It was a lot of things we didn't learn in med school. When we studied melatonin in medicine, in med school and even residency, it was always related to the pineal gland. And I have a question with the amount of melatonin being produced in the mitochondria. Does that affect, the negative feedback loop to the pineal gland?
So that's such a good question. So the melatonin produced by the mitochondrion stays locally. It's not released systemically. So it's very important. So that's why you have this very profound diurnal fluctuation in circulating melatonin levels. So during the day, the levels are low because although you're producing it locally in the mitochondrion, it's not being released into the circulation. So that's a really good question. And so the other people ask is, well, if I take melatonin at night, will it suppress my local production? And that also doesn't happen. So what we figured out is that melatonin circulating levels are very high in children. Kids have very high levels of circulating melatonin. And after the age of 40, it decreases precipitously. And this is one of the postulated mechanisms whereby kids have such a low risk of developing severe COVID because of the high melatonin levels being such a potent antioxidant. The other thing which is fascinating is bats. Bats have because they're nocturnal, have very, very high circulating melatonin levels that really approximate those of kids. And as you know, bats don't become symptomatic from COVID, but if you actually knock out their genes for melatonin, they get sick. So it truly is astonishing how all of these things are tied together.
Right. So I guess we can kind of thank Thomas Edison and maybe even Nikola Tesla, for introducing the incandescent bulb and the fluorescent bulb to change not only what kind of radiation we're receiving, but also the work week or the work day, I should say. With the, I think with the advent of light bulbs and incandescent lights gives us the ability to work longer and have second and third shifts, which is not very healthy, as you know. So while they were geniuses in electrical engineering and that they kind of maybe did disservice to us humans with their inventions. And I had a question about the production in the pineal gland and mitochondria, but you already explained that. Many of us are naturopathic doctors on this program and or integrative clinicians, so we're well aware of the Dr. Keyes study and the influence of pharma and Procter and Gamble on things. And it's just a shame what one person's studies have perpetuated this whole horrible, for many, many years, affected nutrition and nutritional recommendations to the demise of many people.
So you're right. You know, this myth perpetuates to this day. You know, this it's the saturated fat cholesterol hoax. And so you go to the supermarket today, you see everything is low fat. In fact, if it's low in fat, it's high in carbohydrate, and carbohydrates, particularly processed, are toxic, you know, causes insulin resistance. So it's a complete upside down world. And so we should be having, you know, low carbohydrate, high fat. And so this idea that saturated fats are harmful is completely bogus.
Right. We have to tell our patients to bypass all the low fat yogurt, low fat milk. We get, when we purchase milk, it's usually the whole milk, much more healthy. Not only that, but it tastes better too. And I think most nutritionists that are listening in are nodding their heads. Yes, that's true. Let me ask a couple of other questions here. So we do know melatonin, a reduction in melatonin increases cancer and vice versa. So if we have an increase in melatonin, and there are those that prescribe really high doses, 10, 20, 60, I've heard, and even higher daily doses of melatonin to help with cancer regimens or cancer therapies. I guess the theory of shutting down your pineal gland may not be a concern anymore, especially with folks that are giving really high daily doses of melatonin. Because back in the day, I was told you cycle it. If you're on 5 days, take 2 consecutive days off to let your pineal gland kind of reacclimate. One question is, can you
just answer that? So that's a good question. So, I think melatonin plays a role in prophylaxis against cancer because it's antioxidant. It prolongs lifespan. And so for healthy people, you don't need such a high dose. And so, you can get away with a dose. I take 1 milligram. And so if you take a very high dose, until you are used to it, can cause bad dreams. The other thing is you want to take an extended release just because of the pharmacokinetics, so you don't get this rapid spike. But there's really good data in patients with cancer that doses of 20 milligrams of melatonin at night actually have a profound effect in terms of reducing all-cause mortality from cancer. So, it's such a safe drug. It's so completely safe. The LD50 of melatonin is infinity. It's impossible to injure an animal with enough melatonin. It's probably the safest pharmaceutical on the planet. So it has no adverse effects. The only adverse effects are maybe a bit of tiredness or lethargy, but you get used to it. So in patients with cancer, we recommend 20 milligrams, but there are people, as you say, who've used much higher doses up to 200 milligrams. I think Dr. Rater himself takes 200 milligrams. So it is safe. In patients with cancer, studies have shown 20 milligrams very effective. Right.
Yeah, that's part of our protocol. We don't refer to melatonin as a pharmaceutical. We call it a bioidentical hormone. Structurally, it's identical to what's produced in the mitochondria and the pineal gland. So we refer to it that to put people's mind at ease that they're not going on a quote unquote pharmaceutical from big pharma. And I understand it's not very difficult to make. It's fairly inexpensive, although we tend to direct people to sort of pharmaceutical grade dietary supplement companies to get a high quality, so there are no adulterants in there or cypionates that can cause problems. Let's see. So the take home message I'm getting is maybe better than the red lights or the thermalite is full spectrum sunlight, which is free. I mean, we have folks on the FLCC protocol for long haulers, and their supplement pill burden and the expense of all that's pretty high. Last thing they want to do is have to go out and buy an expensive box to sit in. So I tell folks, get out in the sunlight. What is the recommendation for time in sunlight? And I know it's like dawn and dusk is the best time.
So what you say is true. The sunlight is free until Big Pharma finds a way to put a patent on sunlight,
right,
and to actually charge for it, So I think going for a walk, early morning has numerous benefits. You get sunshine and you get exercise, and it's good for your psyche. So, half an hour during the morning and the afternoon is what we would recommend. The worst thing that, someone who has chronic disease should do is stay indoors all the time. That's probably the worst thing to do. So I think, exposure to sun during the day, and then obviously avoiding, light and blue lights and white lights at night to try and, replicate what, Paleolithic man did. Was
right.
He was exposed to sun during the day, and he was exposed to blue light, and then at night, darkness and some fire. And so one needs to replicate that. And the wonderful thing about the sun is it's free.
It's free. Like you said, it's good for the mind to go out and daydream a little bit, get away from your electronic devices like your computer and your cell phone, and generate a little vitamin D, and then, breathing fresh air. The air-conditioned, recirculated air can be toxic to some people, so it's good to get outdoors where you can meditate, make some melatonin, make some vitamin D, and rest your mind. Absolutely.
Yeah. So the only place for radio, the red light or the sauna space is, in winter, or particularly, for those people who live near the North Pole, people in Canada who live in igloos, it's not that conducive for going for a walk. Sure. So, in wintertime, this is an alternative. These lights fortunately are not that expensive.
Right. Yeah. And you have seasonal affective disorder, SAD, which leads to depression. So that's another thing. Full spectrum light's helpful as people sit in front of those light boxes. I was making the recommendation for people in colder climates. I said, hey, you need to photobiomodulate. And they're saying, well, I said, short sleeves and shorts and get out. Now that's fine in South Carolina where I am, because, even in December, we have days that are shorts and t-shirts, days. But I had a patient who was farther north, and she said, well, gosh, it's 12 below zero. I said, well, get in front of a large picture window pane of glass. But now I have to rethink that strategy from what I learned today about what's being blocked with, commercially available glass.
Yeah, I must say that was surprising to me too, actually, and it's obviously important that, sitting by a window, you would imagine you would be exposed to the good sun, but actually the converse happens. It blocks infrared. It allows through the ultraviolet X. So actually it's potentially harmful.
More harmful than good, right? Can you comment a little bit about, the difference between photobiomodulation and photodynamic therapy, especially with methylene blue?
Yeah, so they're kind of on the same kind of spectrum. I mean, I think what you're trying to do is, many patients with chronic fatigue syndrome. I mean, chronic fatigue syndrome is probably a mitochondrial disease, and many people who have chronic disease have dysfunction of the mitochondria. We know that long COVID, and particularly the vaccine injured, spike protein alters mitochondrial function. So, I mean, it seemed, until I started reading this, a little bit fanciful that you could actually target mitochondrial function, but it seems that you can. There are ways to improve mitochondrial function. Methylene blue is truly astonishing because it energizes the mitochondrion. infrared does the same, melatonin does the same. So we have, at least 3 therapies that can directly improve mitochondrial function. And so you see the studies in athletes, because their athletic performance is dependent on, oxidative metabolism and the ability to mitochondria to produce ATP. So the fact that it can improve athletic performance, I think, is a good proof that it actually does improve mitochondrial function and thereby performance.
Right. Right. So a few weeks ago, I had the pleasure of interviewing Dr. Mobeen Syed, Dr. Bean, and his talk was on mitochondria, ATP production, and methylene blue. And the discussion led into, when you do your methylene blue, you probably want to give it 20 minutes to get into full circulation, and then go outside, dawn and dusk, best time, and spend up to 15 minutes in the direct sunlight. He was talking about that's the magic kind of the magic window is 10 to 20 minutes, something in there, 15 best, and that sometimes more than 20 minutes might be counterproductive. And one warning is that maybe we should wear glasses. There's some issues about the methylene blue on the retinas with direct sunlight. So just a caution there. But Paul, thank you, sir.
I think it is a fascinating area of medicine, because we're harnessing nature's, sunlight. I mean, who would have thought that taking patients from the hospital bed and putting them outdoors would have reduced the mortality from influenza? And so, there's really data about patients in psychiatric hospitals, how they improve if you take them outside. Mm-hmm. So it's, it's harnessing the natural, nature and the gems that nature has given us for self-cure.
Yep, absolutely. The universe is all connected. We are made up of, elements, that were dispersed in our universe from supernovas. And there's a reason why our sun is there, and the sun is the center of our little microcosm, and nourishing us, everything from photosynthesis onwards. I had a nurse practitioner in my clinic ask me, actually yesterday, she informed me that there seems to be an uptick or a rise in the amount of tuberculosis, TB, in patients. I don't know if you've heard that. And her question is, what do we do about it? If we don't want to go on these real toxic medications, what can we do to help offset infections with TB?
Yeah, no, that's a good question. It's somewhat out of my area of expertise. So, I'm not sure. What I would say, though, is, we need to ensure people have adequate vitamin D levels. Mm-hmm. So, as you know, vitamin D is so important for the immune system. There are vitamin D receptors in all our immune cells. And despite sunshine, most of us, unless we get a lot of sunshine, I think Dr. McCullough spends his life in the sun and has good vitamin D levels, but most people can't reach that level. So I think it's important to supplement with vitamin D and to achieve levels, above 50. And I think there's really good data in terms of TB and vitamin D levels. So I think the first thing is, is diet, cut out all the processed food, cut out carbohydrates, cut out these breakfast cereals, which are pure glucose, cut out vegetable oils, and then make sure you get adequate vitamin D and melatonin. These are simple interventions. So,
right. More of a proactive, preventive approach. Keep your immune system healthy. That's what I told her.
Yeah.
That's what I would recommend first, without researching into it, which I plan to do in the next few weeks, if this is a for real trend now. But I agree.
So let me tell you one study I recently read, which is truly astonishing. So, this is a randomized double-blind study, so it meets the criteria for the ivory tower. Basically, they showed a simple intervention. Three simple interventions could reduce a person's risk of cancer by 50%. Isn't that an astonishing finding? And isn't that of such importance, yet no one wants to talk about it? So they basically showed that the combination of vitamin D, omega-3 fatty acids, and home exercise program, those 3 interventions, significantly reduced a person's risk of getting cancer. Isn't that important?
Go figure. Three very, very affordable things to do, you know.
Yeah, and I would add to that melatonin, which is, equally cheap and effective. And so, people can proactively, empower themselves to take control of their health.
Absolutely. Yep. I think we need to return to those values that we have to keep our temples healthy, avoid the toxins in our environment, and get out, become less sedentary, get out, move around, get out in the sun, de-stress. I mean, stress is a big factor. People are doing too much. They're stressing themselves out. But Paul, Marik, thank you so much for this. It was a great, I'm sure our attendees this year are going to glean a lot of good information and walk away with a lot of new knowledge from your presentation. So I do appreciate it.
Sure. And what I would say is this is just, an introduction. There's a lot of literature and data on this. And so it's not hidden. People should read up about it because it is truly an astonishing, fascinating area of medicine and who would have thought? And as you said, they do not teach you this at medical school.
You sure don't.
Because big pharma can't patent it. So that's why they have a problem.
That's very true. Well, thank you so much, and I will see you soon.
Thank you, Hey.